Welcome to the Deep Dive. Today we're tackling a topic that, well, might not be top of mind for every pet owner, but it's definitely something worth understanding. Chronic lymphocytic leukemia, or CLL, in our dogs and cats.
hmm
We've sifted through some really detailed information to bring you the most important and interesting bits about this condition affecting our furry companions.
Exactly. Think of this as your streamlined guide to grasping the essentials of CLL in pets.
Okay.
Our goal is really to clearly explain what it is, how it impacts them, and whether you're a dedicated pet owner or someone interested in animal health, really need to know, all without getting bogged down in, overly complex medical terms.
Okay, so let's dive right in then. What exactly is chronic lymphocytic leukemia in dogs and cats?
Well, at its heart, CLL is an uncommon type of blood cancer. It's what we call a lymphoproliferative disorder.
Okay, lymphoproliferative.
Yeah, which essentially means there's an overproduction of lymphocytes. Now, lymphocytes are a specific kind of white blood cell, really crucial for the immune system.
Right.
What makes it chronic is that it tends to develop and progress quite slowly,
Mm-hmm.
often over many months, sometimes even years.
Slowly. Okay.
And the excess lymphocytes produced are mature and what we call well-differentiated. They look pretty much like normal lymphocytes under a microscope, just there are far too many of them.
Mm.
These abnormal cells, they can start their proliferation either in the spleen,
The spleen, right.
which is an important organ for filtering blood and immune responses, or in the bone marrow, the primary factory, for producing all types of blood cells.
So in simple terms, it's like their body is making way too many of a specific type of immune cell, and that's happening either in their spleen or their bone marrow.
Precisely. And this overproduction, it impacts two key systems. The hematopoietic system,
Which is the blood-forming tissues.
that's right, all the tissues involved in creating blood cells. And also the lymphatic system, the network of vessels and nodes vital for immunity. Those are the main areas affected by CLL.
That gives us a really clear picture to start with. Now, when we talk about which pets are affected, are there certain age groups or maybe types of animals that are more likely to get CLL?
It's a fascinating area, actually. We see a notable difference in how often it occurs in dogs versus cats.
Oh, really?
Yeah, CLL is actually diagnosed more frequently in dogs. When we look at age, dogs tend to be older when diagnosed, with an average age of around 10 years.
10 years, okay.
However, it's important to keep in mind that the age range is quite wide. We see cases in dogs as young as maybe a year and a half, all the way up to 15 years old.
Wow, that is a wide range.
It is. And in cats, the median age at diagnosis is a bit older, around 12 and a half years. And again, the range is broad, say from 5 to 20 years.
Yeah.
So while it's more common in senior pets, it's definitely not exclusively a disease of old age.
It's interesting to see that wide age range. Does sex play a role at all in who gets CLL?
Interestingly, yes. In both dogs and cats, there appears to be a tendency for males to be more affected.
Yep.
The ratio is approximately 2 males for every female diagnosed with CLL in both species.
2 to 1.
Yeah. That's a statistic that often surprises people. Perhaps there are, underlying hormonal or even subtle genetic factors at play, although that's an area that probably needs more research.
That's definitely something you don't often hear about with pet health issues. Now, if a pet does develop CLL, what kind of changes might an owner observe? What are some of the things that might make them think, something isn't right?
This is a really critical point because the initial signs can be quite vague, especially in the early stages of the disease.
Right, subtle.
Exactly. In fact, some animals might not show any noticeable symptoms for a considerable time. This can make early detection pretty challenging.
I bet.
However,
No.
as the condition progresses, owners might start to notice things like increased tiredness or lethargy.
Just seeming more tired than usual.
Yeah. Or a decreased interest in food, leading to a loss of appetite and maybe unexplained gradual weight loss. Physically, we might see lymphanomegaly, which just means the lymph nodes throughout the body become enlarged. You might feel lumps under the jaw, maybe in front of the shoulders or in the groin area.
So owners might actually feel those?
Sometimes, yes.
Yeah.
Similarly, the spleen might become enlarged, a condition called splenomegaly, which your vet might detect during an examination.
Gotcha.
Other potential signs could include things like a persistent fever, increased thirst, polydipsia, and consequently increased urination or polyuria.
So it sounds like many of these signs could also point to a whole bunch of other health problems. That must make it tricky for vets to narrow it down.
Exactly right. Because the initial symptoms aren't specific just to CLL, veterinarians have to consider a range of other potential conditions, We call these differential diagnoses.
Right.
This includes other types of cancer, particularly lymphoma, especially if it is spread to the bloodstream, what we call a leukemic phase.
Okay.
Acute lymphoblastic leukemia, which is a much more aggressive form of leukemia, also needs to be ruled out.
Makes sense.
Then there are non-cancerous conditions that can cause an increase in lymphocytes, such as immune-mediated hematologic diseases, where the body's immune system mistakenly attacks its own blood cells.
Oh, wow.
And certain chronic infections can also lead to elevated lymphocyte counts. Examples like ehrlichiosis, leptospirosis, leishmaniasis.
So infections too.
Infections too, yeah. Even some acute viral infections can temporarily cause an increase in these cells.
That's quite a comprehensive list of possibilities. So how do veterinarians actually pinpoint CLL? What are the key tests they rely on?
The primary tool for diagnosis is usually a complete blood count, or CBC.
The CBC, standard blood test.
Exactly, a routine blood test that looks at all the different types of blood cells in a sample. In animals with CLL, the CBC typically shows a significant increase in the number of lymphocytes that's called lymphocytosis.
And how significant are we talking?
Well, it's a really wide range, anywhere from 5,000 up to potentially hundreds of thousands of lymphocytes per microliter, so in a tiny drop of blood. Often, these excess lymphocytes appear to be small and mature-looking. However, it's interesting that in over 60% of dogs with CLL, these lymphocytes have a specific appearance called large granular lymphocyte, or LGL morphology.
LGL, okay.
Yeah. And as the disease progresses, maybe into a more advanced stage called blast crisis, larger, more immature-looking cells might also start to appear.
So the CBC gives them a strong initial clue, but is that usually enough to make a definitive diagnosis on its own?
Not always, no. While the CBC is a crucial first step, other findings in the blood work can also be suggestive.
Like what?
For instance, there might be a mild to moderate non-regenerative anemia.
Meaning the body isn't making enough red blood cells.
Correct. The body isn't producing enough new red blood cells to replace the old ones. The platelet count, which is important for blood clotting, might be normal or slightly low, although a significant drop is less common, occurs in maybe less than 20% of cases. Biochemically, the levels of serum globulins, a type of protein in the blood, might be normal to mildly elevated. But to get a more definitive diagnosis and to rule out those other conditions we talked about,
The differentials.
right, the differentials, further laboratory tests are really essential.
What kind of further tests are usually involved then?
Well, a cytologic examination of the bone marrow that involves taking a sample either through an aspirate, like with a needle, or a core biopsy can be very informative.
Right, looking right at the source.
Exactly. In CLL, this often reveals a high number of those mature lymphocytes, especially in the more common B-cell type of CLL. In later stages, these lymphocytes can become so numerous that they actually start to crowd out the normal blood-producing cells in the bone marrow.
Okay.
And to specifically identify what type of lymphocyte is involved, is it a B cell or a T cell? We often use specialized techniques like immunocytochemistry, flow cytometry,
Flow cytometry, right.
and a genetic test called PCR for antigen receptor rearrangement, or PAR for short.
PRR, that sounds specific.
It is. This PR test helps us precisely identify the type of abnormal white blood cell. It's quite sophisticated.
And other tests.
Yeah. If the blood work shows that increase in globulins, hyperglobulinemia, a test called serum protein electrophoresis can be done to check for something called monoclonal gammopathy.
Which means?
It indicates an overproduction of one specific type of antibody, which can happen with some forms of CLL. Also, a direct Coombs test might be done to look for secondary immune-mediated hemolytic anemia.
Where the immune system attacks red blood cells.
That's the one. It can sometimes be associated with CLL. And because certain infections can mimic some aspects of CLL, blood tests to check for specific infectious agents, like serology for Ehrlichiosis, might also be recommended depending on the case and location.
That sounds like a very thorough investigation. Does imaging, like X-rays or ultrasound, play a role in diagnosing CLL as well?
Yes, imaging can definitely provide valuable supporting information. Techniques like radiography, X-rays and ultrasonography can help detect if organs, like the spleen or maybe lymph nodes inside the abdomen, are enlarged, which can support the diagnosis and also help assess the extent, sort of the stage of the disease. Ultimately, however, a definitive diagnosis often relies on those more invasive procedures we mentioned, like the bone marrow aspiration or biopsy.
Right.
as well as taking samples from enlarged lymph nodes or the spleen for cytology or histopathology, basically looking very closely at the cells and tissues under a microscope.
Okay, so we have a good understanding now of what CLL is and how it's diagnosed. Let's move on to treatment. What are the options for managing this condition in dogs and cats?
Right. In the majority of cases, treatment for CLL is managed on an outpatient basis, usually using oral medications that owners can give at home.
So mostly pills at home.
Mostly pills at home, yeah. In certain circumstances, though, particularly if the spleen is significantly enlarged and seems to be the main site of the abnormal lymphocytes, or maybe it's causing the pet problems like discomfort or low blood counts, then a splenectomy, which is the surgical removal of the spleen, might be considered as part of the treatment plan.
Okay. And when do vets typically decide to start treatment? Is it immediate?
Not always. Generally, treatment is started when the animal begins to show clinical signs, things like that weight loss or lethargy we talked about.
Right, the noticeable symptoms.
Exactly. Or if there's noticeable enlargement of lymph nodes or other organs, if their red blood cell or platelet counts drop too low, we call those cytopenias, or if the lymphocyte count itself climbs above a certain threshold. Typically around 50,000 per microliter is often used as a guideline.
50,000.
But it's really crucial, and I want to emphasize this, for pet owners to consult with a board-certified veterinary oncologist for the most current and tailored treatment recommendations. They're the specialists.
Absolutely. So what are the main medications that are typically used to treat CLL in pets?
The primary medications often involve a drug called chlorambucil, which is a type of chemotherapy drug,
Okay, chlorambucil.
and a corticosteroid like prednisone or prednisolone. The information we looked at provides specific dosage guidelines for chlorambucil in both dogs and cats, usually starting with a slightly higher initial dose.
An induction dose.
Sort of, yeah, an initial dose followed by a lower maintenance dose that's adjusted based on how the pet is responding to the treatment, and importantly, regular monitoring of their blood counts.
Makes sense.
Prednisone, or prednisolone, is frequently used in combination with chlorambucil. And the good news is the dose of the steroid can sometimes be gradually reduced or tapered, and maybe even stopped once the lymphocyte count returns to a more normal range.
That's good.
It is. It's also important to know that if the pet stops responding to these initial treatments, or if the disease progresses to that more aggressive phase we mentioned, the blast crisis, then veterinary oncologists will consider other chemotherapy drugs and different treatment plans. There are alternatives.
Are there any particular precautions or potential issues that owners should be aware of when their pet is on these types of medications? Like chemotherapy drugs?
Yes, definitely.
Yeah.
Because chemotherapy drugs can have side effects, it's really important for owners to have a thorough discussion with their veterinary oncologist before starting treatment, especially if they haven't dealt with these types of medications before.
Understand the risks.
Exactly. The oncologist can explain the potential side effects to watch out for things like maybe decreased appetite, vomiting, diarrhea, or effects on the bone marrow, and any possible interactions with other medications the pet might be taking.
And how closely do vets monitor patients who are undergoing treatment for CLL? You mentioned blood counts.
Yes, close monitoring is key, especially when treatment is first initiated. This typically involves having complete blood count examinations done pretty frequently at the start, maybe every couple of weeks.
Every 2 weeks.
Initially, yeah. To assess how the pet is responding to the medication, to make sure the lymphocyte count is coming down, and also to monitor for any signs of the disease progressing or any adverse side effects from the treatment, especially on the bone marrow.
Speaking of side effects, are there any common complications that can arise during the course of treatment?
One potential complication is what we call chronic chemotherapy-induced myelosuppression.
Myelosuppression, so suppressing the bone marrow.
Exactly. It basically means that the chemotherapy drugs can sometimes suppress the bone marrow's ability to produce healthy blood cells, not just the cancerous ones.
Okay.
So if the levels of neutrophils, which are white blood cells important for fighting infection, or platelets, which are needed for clotting, drop too low, it might be necessary to adjust the dosage of the chemotherapy medication, or maybe even pause it temporarily.
Got it. Need to be careful there.
Absolutely. It requires careful management.
Finally, what can pet owners generally expect in terms of how CLL progresses and, well, what the outlook is for their dogs or cats diagnosed with this condition?
The course of CLL can vary quite a bit from one animal to another, but unfortunately, it is typically a progressive disease.
Progressive. Oh,
Over time, there's a possibility that it could transform into that more aggressive blast crisis phase we mentioned, or the cancer cells might become resistant to the treatments being used.
Hmm.
However, and this is the important part, the good news is that with appropriate treatment, we can often achieve significant periods of remission where the disease is well controlled. And this can greatly improve the pet's quality of life for quite some time.
That's encouraging.
It is. The information we looked at provides some helpful data on average survival times with therapy. For dogs with the more common B-cell CLL, the median survival time is around 18 months.
18 months.
And for dogs with the T-cell form, it can be even longer, potentially exceeding 24 months.
Over 2 years for T-cell?
Potentially, yes.
Hmm.
And in cats, one study showed a median survival time of over 14 months with treatment. So these figures, while they're just averages, they give us a more concrete understanding that treatment can really make a difference in how the disease might progress.
That's really valuable information and definitely offers some hope, I think, for pet owners facing this diagnosis. So, just to recap quickly, CLL is a slowly developing blood cancer in dogs and cats. While the initial signs can be subtle, maybe easily missed,
Very subtle sometimes.
a thorough diagnostic process is crucial for identification. Fortunately, there are treatment options available, and as we've learned, advancements in veterinary oncology are allowing for significantly extended survival times and, importantly, improved quality of life for many affected pets.
Absolutely. And for you, the listener, the key takeaway really is the importance of being observant of your own pet's health and being proactive. Seeking veterinary care if you notice any persistent changes or concerning signs. Having this basic understanding of CLL can empower you to have more informed discussions with your veterinarian if, the need ever arises. If you do notice any of those symptoms we discussed, like that ongoing lethargy, unexplained weight loss, maybe swollen lymph nodes, it's always best to consult with your vet. Don't wait.
Good advice. And that brings us to our final thought for today. Given that the precise triggers or causes for CLL remain, well, pretty unclear,
Largely unknown, yeah.
what exciting new directions in veterinary research might hold the potential for breakthroughs in preventing this disease, perhaps? Or developing even more effective and targeted therapies for our beloved animal companions in the future? It's definitely a question that hopefully future deep dives can explore.
Absolutely. Lots more to learn.
Thanks for tuning in today.